Welcome back to your weekly rounds. I am Dr. Corey King of AskDrKing.com, located in Lafayette, Colorado. I specialize in helping patients regain their lives back that have been struggling with thyroid gland disorders, autoimmune conditions, chronic viral infections, Lyme disease, and mold toxicity. In today's weekly rounds video, we're going to be going over a 16-year-old female that her parents reached out to me several months ago, and she's been struggling with a whole host of symptoms. So she's been diagnosed with Hashimoto's disease, which is what my wife has, Celiac Disease, and Raynaud's. Originally, when her parents reached out to me, they wrote me a little letter, and these were her symptoms. So I want to share this with you so you can see what this 16-year-old has been going through. And they said that we spent the last 3 years going to different doctors and specialists, and her daughter still doesn't feel better. So she's been struggling for 3 years. Her Hashimoto's antibodies are still sky high, and no one seems to care that much about it. She deals with extreme bloatiness, so she's having bloatiness up to 4 inches of bloat every single day, and usually always after eating. She has nodules that are on her thyroid, which is classic for a Hashimoto's patient. Constant rashes on her legs. She has carpal tunnel-like symptoms, body aches, swollen feet, migraines, heart palpitations, and she can't stay awake throughout the day. She's 16 years old. Originally, her doctors had her on some thyroid medication, but she was reacting to the thyroid medication, and so now her parents actually have her off of that, but they're concerned that she's going to go in essentially a hypothyroid state because of the Hashimoto's that would be attacking her thyroid. So they reached out to me originally. I shared my thoughts with them. I said, this is what I think that is going on. To me, it sounded like a classic case of Sibo as one of the underlying infections that could be driving her autoimmune conditions. Well, what ended up happening was they went to see a local doctor that they were referred to from some family and friends, and their daughter actually got worse. This doctor was telling them that it was only Candida that was occurring, and the Candida was causing all of these symptoms, and they tried to treat the Candida, but unfortunately their daughter's symptoms got worse, so they reached back out to me. And I said, okay, let's test for Sibo. We are going to test for Candida because I do agree with that doctor. There probably is some Candida that's occurring. And then we're going to run some genetic testing, which, as you know, if you've watched some of these weekly rounds videos, I do genetic testing on every single patient. So let's take a look at our Sibo test results. This is a new test. I haven't shown this on any weekly rounds, but I want you to be familiar with it. So if you or a friend or family member complains of extreme bloating where they may look like they're 3, 4, 5, 6 months pregnant, that is classic Sibo. So let's take a look at these results. So what we're looking at here, this is a test from Genova Diagnostic, and essentially patients are going to be drinking this lactose-like formula, which unfortunately for lactose-free can create some stomach issues or some gassiness, but unfortunately you have to do it. So you drink this liquid and then you collect these samples every 20 minutes. It's essentially a breath test. And so I do the 3-hour Sibo test from Genova Diagnostics. Sibo stands for Small Intestinal Bacterial Overgrowth, and we're going to talk about that, what it means here in just a moment. But if you just look at the two results at the very bottom, her hydrogen levels and her methane levels, this is what we do, or this is what we use to determine if there is Sibo, and her hydrogen levels were almost 3 times higher than what they should be, and her methane levels were almost 2 times higher than what they should be. This is classic small intestinal bacterial overgrowth. What that means is there's bacteria from the large intestine that is working its way into the small intestine that should not be there. There's a variety of reasons why this happens. We see it happening due to head trauma, food allergies that are creating inflammation that is causing what's called an ileocecal valve to remain open between the small intestine and the large intestine. That's what allows the migration of that bacteria into the small intestine. History of antibiotic usage, certain medications. So there's many reasons why Sibo will begin to occur, but this is how we're going to find it. This is how we're going to diagnose it. So unfortunately, they were told the wrong thing, that she didn't have Sibo, but that one doctor was correct. So let's look at her Candida test results. Now granted, she's already been treated for Candida, but we're still seeing here, number 7 and 8, pretty daggone high. So these are some metabolite markers that are telling us that she does have Candida. So the other markers 1, 2, 3, 4, 5, 6, and 9, that's how we want 7 and 8 to look. So I would still be treating her for Candida. She still has high levels. Maybe what they were doing before, maybe it knocked these levels down some, but it didn't completely eradicate them. And then if we look at our bacterial markers, we're starting to see number 13, and we see 15 and 16 and 17. All of these are getting elevated, and these are different strains of bacteria. Well, this makes sense because she has an overgrowth of bad bacteria in the system, but it could also be complicated by these high levels of bacteria. So we're going to go in there, we're going to apply a Sibo protocol and layer in a Candida protocol at the same time. So we're going to do a blend or a mixture of how I would treat these two conditions. Now, you know that we always test genetics. So let's go and look at our genetic testing. So here's her first genetic test. This is the methylation section. She does have one of the main methylation mutations, the MTHFR 1298. She's homozygous for this, and then she has these other 1, 2, 3, 4, 5 mutations on top of that. So what methylation does is it helps to regulate the immune system, meaning it tells the immune system, there's a bad guy, go kill it, or, hey, don't attack my own body, don't attack my thyroid tissue, Hashimoto's, don't attack my gastrointestinal lining, Celiac disease. So she's got multiple genetic mutations that makes it really hard to see and kill bad guys, and it makes it really hard to protect the body from being attacked from its own immune system. So this is getting to some of the true deep-rooted answers as to why she has these autoimmune conditions. We just figured out she has Sibo, she has Candida, she has food sensitivities and allergies. We're going to talk about that in a second. So that's the fuel that fuels the fire of the autoimmune conditions, but the genetic mutations are getting to these deep-rooted answers. Let's dive in further. So then she's also struggling with anxiety. So here is her neurotransmitter genetic test result. She has all 5 of these mutations, and that's going to predispose her to anxiety, especially situational anxiety. Now let's look at her detoxification section. So she does have one of the main glutathione mutations, the GSTM3 that is mutated, and she also has the NAT2 mutation. So her body, one, it has a hard time making glutathione, which is considered the mother of all antioxidants. Its job is to get inflammation down and to bind toxins. And when she has this NAT2 mutation, she's going to have a real difficult time detoxifying carcinogens. So think carcinogens, cigarette smoke, maybe some chemicals that you could be around while you're working or while you're traveling. Anything that is labeled a carcinogen, the body's going to have a hard time getting that out of the system in her case. That means it's going to create inflammation. Her liver is going to have to work overtime to try to detoxify that. Her liver helps to convert her thyroid hormone. So she's on a thyroid medication. She may not be converting her thyroid hormone and getting it into her cells. She's going to have a hard time getting inflammation down. She'll have a hard time clearing hormones. So this is why it's important to look at these genetic mutations, because it's going to give you lifelong answers. Now we're going to look at our inflammatory genetic mutations, and there's one gene in particular I want to draw your attention to. It's the NOS2, NOS2 at the very bottom. That mutation, I see it in every single Epstein-Barr virus patient. So what does that mean? That means every single Epstein-Barr virus patient I've ever worked with has had this mutation. So if we can check these genetic mutations before somebody ever has a problem, we can start to essentially predict the future, so we can teach patients how to improve their immune system, so that way they don't have to go through the years of struggle like my wife went through due to the Epstein-Barr virus. All these mutations tell us she has a hard time calming down inflammation, so we're going to apply some therapeutic interventions to help calm down inflammation in her system, and then teach her what she can do later on in life once she's feeling better, how to manage inflammation if she ever cheats on her foods or she's around chemicals that her body can't clear properly. This next section is extremely important for her because we learn a couple really important facts. One, she doesn't make probiotics very well. That's that second mutation, the FUT2. And then the next few mutations, the HLA-DQA1 and DQA2, those mutations tell us if she consumes gluten, she's going to develop celiac disease. She's already been diagnosed with celiac. So if, rewinding a little bit, if you will, if her parents would have known about this ahead of time, then they could have started her on a gluten-free diet many years ago, and she would have never developed the celiac, because the celiac is driven by gluten. And that's the medical model's approach as well. If you have celiac, remove the gluten. And that's the same thing that we've told this patient, but she's already gone gluten-free. She's 16 years old and she did it on her own. And she has a couple autophagy mutations. Her body doesn't like to detoxify the junk inside of the cells. So that's something that we're going to talk with her about, and maybe even talk about intermittent fasting to help promote autophagy for her. And she needs to take vitamin K in order to help absorb vitamin D. Her last genetic mutation that was really important for us to see was this first one here called FOXE1. She was predisposed genetically to developing an autoimmune condition. Her father actually has Hashimoto's, and his family members have had Hashimoto's as well. So genetically it's been passed down, and we see it in her genetic test results. So this patient is just getting started with her protocol this week, so I'll bring some updates later on once she's starting to feel better. But this is a classic Sibo patient, looking like they're 3, 4, 5, 6 months pregnant, 4 inches of abdominal distension throughout the day. Classic Sibo. She has 3 autoimmune conditions. The Sibo is making this worse. The Candida is making this worse. But now we also see her genetic mutations, so that way once we help her get better, she'll know what to do to keep herself there. And then when she has children one day, she'll be able to tell what genes she actually passed down to her children. So again, this is Dr. King from AskDrKing.com, and we look forward to seeing you on the next weekly rounds.